In the right parasternal long axis for chamber view, there is a regurgitant jet pass through mitral valve and tricuspid valve. You can clearly appreciate how right atrium in the top right corner and left atrium in the bottom right corner were enlarged if compared with the ventricles. Interestingly, there is decreased septal motion. Furthermore, there is remarkable right ventricular enlargement when compared with the left ventricle. The left ventricular posterior wall and interventricular septum are fibrosed and lack of muscular echogenicity. In this right parasternal short axis at the base of the heart, you will note that there is a quite clear spontaneous echo contrast in the right atrium and left atrium, and by eyeballing you can appreciate that left atria aorta ratio is far more than 2.5 or 3. Interatrial septum are subjectively intact. Note also that left atrium and right atrium has prominent decreased systolic function, and by integration of these findings, we can conclude that this cat is suffering from hypercoagulable state and in a high risk of feline aortic thromboembolism event. This is also right parasternal long axis for chamber view. You can appreciate how the decreased contractility and the fibrotic left ventricular posterior wall and interventricular septum. In this view, we can see marked ascites in the abdomen and lack of collapsibility of caudal vena cava with smooth edge of liver. Therefore, the ascites is most probably cardiogenic. In this left apical view, in a dual color Doppler mode, the jet is eccentric, which highlight the severity of the regurgitant jet. You can see that the jet comes through the posterior wall of the left atrium. In the M mode, you can appreciate that decreased systolic function of fractional shortening around 30% and end systolic volume of 5.8 milliliter. There is also lack of collapsibility of right main pulmonary branch or right main pulmonary artery, highlighting the pulmonary hypertension probability in this patient when integrated with the tricuspid regurg and the ascites and right atrial and right ventricular enlargement. Mitral valve regurgitation was around 4 meters and E wave was around 1.4 meters, which highlight high pressure in left atrium. There's also decreased apsy in the M mode, which highlight the severity of systolic dysfunction. There is a pulmonary pump in the pulsed wave Doppler, also as a criteria of pulmonary hypertension. So what is your differential list and